Hello Success Nation, I hope you're having a good day. A question that people have asked me about the RCA is how do I decide whether this is a low challenge or a high challenge case? As you know, for the RCA, it's important to avoid submitting any low challenge cases because you're unlikely to score well for these cases. So it's very important to aim for moderate to high challenge cases for the RCA. So the way I thought about whether this is a low challenge case or not is to ask myself whether an advanced nurse practitioner or a pharmacist could have dealt with this case. If that's the case, then it's not a high challenge case and it's deemed to be a low challenge case. Any case that could be dealt with by an advanced nurse practitioner or a pharmacist is a case that I would avoid submitting. Now let's think about the moderate to high challenge cases. The way I decided whether a case is high challenge is to ask myself whether a GPST1 or a GPST2 would struggle with these cases. If they would struggle, then it's deemed to be a higher challenge rather than moderate challenge, and it's a good way of thinking about the level of complexity of a case, how challenging it is. The different dimension in terms of how we decide whether a case is challenging or not. And the college has made a clear report about all this dimension that you need to think about. So the first one is to think about the diagnosis. If it's a common diagnosis like a UTI or a chest infection, it's unlikely to be a challenging case because this is something that's dealt with commonly. If it's something less common or rare, such as myasthenia gravis, then it creates more challenge to the case. Other things to think about is the psychosocial implication. If the patient has got other psychosocial complexity in the case, or if you're managing a patient who has a lot of anxiety and you need to reassure them and to use a lot of your interpersonal skills, then it makes a case more challenging. So the diagnosis on its own is not a reason for not submitting a case. It could be that you might have a simple case of a diagnosis of UTI, but if there's more complexities in the case, then you might think that it's a good suitable case that you may be able to submit. So in terms of when you're selecting your cases, it's very important that you look at the balance of cases. You need to make sure that you're covering the curriculum and it's a well-balanced set of selection. You don't want to submit cases that are identical because then it's more difficult for you to show your skills as an independent and safe GP. So the way I thought about it is that I rank all my cases. So I mark them individually and I rank them according to the score for each case, and then I made sure that I'm submitting a selection that shows a good coverage of the curriculum. And in some cases, if you find that you're having moderate to low challenge, then you might need to think about how you can select your cases better before consulting and ask to get some more challenging cases rather than just run on the mills that's not very challenging. So it's very important that you think about how you're sourcing these cases and what's the system in place when you're consulting before even seeing the patient or talking to the patient. I hope you find this useful. Let me know if you have any question down below and I'll see whether I can help you with your queries. Take care everybody. Bye bye.